Years, they're right. Used to think 40 was old. Not anymore. Not anymore. It's not. So how I feel some days lately.
Yeah. That's exactly right.
Great, how are you?
I was like, a little, that's a little pressure.
You're on. All right, I'd like to call the January 24th St. Joseph County Department of Health Board meeting to order. At this time, we'll take nominations for president.
I would like to nominate John Lynn for president. Should I make a nomination for vice president? As well?
And if you'd like, or we can do one at a time.
Okay, well, I'd also like to make a nomination for Michelle Migliori for vice president.
I
have
will
a motion.
second.
I have a motion and a second. Any discussion? Hearing none, all in favor?
Aye.
Aye.
All opposed, same sign. Mr. President, I'll turn the meeting over to you.
Very good, thank you. Next item on our agenda is the adoption of the agenda. So I believe all the board members have seen the draft agenda. This time, like a motion to approve or comments or whatever you want.
I'll move to approve.
Second.
The motion is second. Any further discussion? All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries.
Yeah.
Nope.
There's an amendment to the agenda.
We just approved it as is. I'm not sure. Oh,
What's the amendment?
on
Adding that,
the committee.
the grant.
Yeah, I think that we're gonna postpone that. Talk about it next month, if that's okay.
Yep, that's correct.
Are we talking about the amendment to apply for the emergency preparedness grant?
Yes.
No, okay. That wasn't on here?
Yes.
Can we go back and amend?
Someone can make a motion to
I would
amend
like
the
to make a
agenda.
motion to amend the agenda to include the emergency preparedness grant, please.
I will second.
All right, we have a motion and a second. Any further discussion or other amendments?
And just to be clear, we'll have that listed right at, in section 8 grant requests, right after receiving the health CHW grant.
Sounds good. Any other further discussion? All those in favor, please say aye.
Aye.
Opposed, same sign? All right, motion carries. Thank you. Next item on the agenda is the approval of the minutes. I believe everybody's received the minutes from our December 13th, 2023 meeting. Questions or a motion?
I just realized I had one comment, one possible change to the minutes. Can I say that now or do we have to? Okay. In the public comment section, there, the one gentleman who spoke at our meeting in December, it lists his full address. Do you think we could just list residing at Granger, Indiana? Would that be sufficient? That way we don't have to, dock somebody with their address. We just remove his street address and just say Granger, Indiana. It says.
You can if you want.
Yeah.
Right.
Is there any pros or cons of that or? Is it?
No, I mean, the correct protocol is for them to state their address so that the department knows, but we don't have to put it in the minutes. We could strike that and just say city. I mean, Jenny's got the rest of it.
I mean, this is on the website, so that's why I thought,
Yeah. Good.
Granger is enough to show that he lives in the county.
Was that a motion?
I would like to move to accept the amendment minutes with the proposed amendment I just discussed to remove his street address.
I second to strike the street address of the public comment person
And approve the minutes?
and approve the minutes.
All right, any further discussion? Here,
Is that something we're gonna do for everyone from now on then?
We don't usually put the street address.
Okay.
We keep a record of it, right? Because Jenny's got the tapes, but
Okay.
we don't usually publish them.
as a general policy, it makes sense to me to not put the street address.
Yeah.
Agreed.
there.
Mhm.
Okay.
All right, any further discussion? All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Board president announcements. I don't have any announcements at this time. I'll try and think of some for the next meeting though. Health officer, next item, health officer presentation and report.
Hello. Thank you everyone for the opportunity. First of all, Happy New Year. The health department's very excited about all the good opportunity we have to make an impact in our community this year. So a few updates. First, I wanted to start off by refining the mission and vision of the health department. So when I first started the health department leadership, and then we rolled this out to all of the employees, we talked about what should be the mission and the vision, making sure that it really echoes the sentiment of the health department. You should see it in your packet after the health officer report. And so I'm going to just take a minute to start the health officer report with this statement. So the vision for us is optimal health for a thriving St. Joseph County. And our mission is to promote health and wellness with compassion and integrity through partnership, education, protection, and advocacy for all who reside in and visit St. Joseph County. And with that, I just wanted to start the tone for the health officer report. I'll start by talking about Health First Indiana. We did get the funding. We did receive $3,293,255.46, out of which we are planning to spend $973,755.46 on grants that we talked about in December. We have gone to council committee, which happened yesterday, and they had a favorable recommendation for the budgets that were approved by the Board of Health. The next step is for us to have that information heard at public hearing. And then if that gets approved, it'll go to the commissioners on February 20th, at which time we would be sending out grants to the awarded recipients and having them sign it, and then having our commissioners sign it. And at that point, we would be ready to execute the contract, provide the funding, and begin all of the good work we're hoping to do in our community with HFI funding. Any questions about that before I move on?
Do you know the date of the public hearing? That's at the county council level, right?
Yes, and it's February 13th.
Thank you.
Okay.
Good job.
Thank you. The team did a really strong work, so I appreciate it. The other thing I just wanted to kind of call out in the health officer report is the general overall productivity and success of the various units. We've been pretty busy in almost every unit. I would like to highlight a performance award that we received for the MIH-CHW work at the Women's Care Center. And because of the excellent work that we were doing, we did receive the Health CHW Safety Pin Grant. So that continues the work that we're going to do with Women's Care Center and helping us expand our growth and vision for maternal and child health in our community. I also wanted to point out that with all of the grants that we have been able to obtain and execute, we were actually able to contribute about $555,000 to the county fund balance through salary recovery from various grants. So I just wanted to take a minute of gratitude for the health department and all of the work that it's done in the past quarter and throughout last year, because I think they've done an excellent job. And one of the goals for this meeting is to kind of highlight and showcase what we're doing in the lead space. And as we start doing these spotlights in the second round, we'll start to see more of the new programming that we're going to be executing with Health First Indiana and the quality measures and some of the specific goals of those projects. So today we're going to be highlighting lead. Any questions before we move on to that?
I'll just make a quick comment about and express my appreciation to the staff and the department. It's been obviously a pretty rocky year with a lot of unknowns and question marks, and all along, we urged you to hang in there with us and give us a chance to deal with the issues that we had to deal with. So I really appreciate those that hung in there and that are doing the good work, and it's been turned out to be a really great year. So thank you all. Other thing I just want to ask, is there anything you want to add about the process by which you went through on the new vision or mission? Was there anything of particular importance to the staff and to you that's built in here that you want to expound on, or does it speak for itself?
I think it speaks for itself, but I would highlight the fact that we wanted to be much more welcoming and inclusive in our vision, which was to include those that live here and also those that visit here. That was an important point to make. And then just that notion of what is health and wellness, and that it's a holistic process that isn't just one specific component. I think those were some of those key highlights that we wanted to make sure we incorporated into our mission. And it is reflected in the strategic plan that we're working on building and completing.
Great, thank you. Any other comments or questions? So I was gonna make a comment about the award that you received. Was that an actual, was there an event for that, or was there a meeting, or?
Not to my knowledge, I don't think there was an event for it. It was just a performance award that acknowledges the good outcomes that we were having, and it allowed us to receive a grant without having to apply for it.
Oh.
But I'll pause and look over at Robin to make sure I'm saying this right.
No, you are correct. The award was given to us in the form of the refunding of the 2 years of the
Mhm.
program.
Oh, well, that's nice.
Yeah.
What was the dollar amount of the program again? I think it's in here, but
276,000, it's $275,754 is the new amount for the 2-year cycle.
okay. And that'll fund a significant portion of the MIH program in
Mhm.
general. Good. And
Any other questions or comments?
I wanted to invite Michaela up to kind of talk about our lead spotlight and our interdisciplinary unit approach to the lead poisoning issue in our community.
Oh, could I ask one more
Yeah.
question about the health office report? I was curious, there on one of the pie charts, I couldn't tell if it was if housing was the issue that those interviewed needed help with, or if it was education. I was just curious on page 28. Under,
Housing tends to be one of those priority areas.
so is it 199, is that the housing area pie chart on the pie chart? Or is it the 20? I just couldn't tell on the color, which was.
I would think it's the larger amount.
Yeah. Looks like the 199.
Yeah.
It's the 199,
Mhm.
So.
and the 20 is the education and safety.
Mhm.
So housing, I suspected it was housing because we've talked about that several times. So that's certainly a need in our community. So,
Yeah.
thank you. Apologize. You have the floor.
Thank you. Hi, everyone. My name is Michaela Enright. I am the Disease Investigation Specialist for lead here at the St. Joseph County Department of Health. And today I'll be presenting on our response to preventing childhood lead poisoning. Oh, okay. Here's an outline of what I'll be discussing today. Today I'll be talking about what lead is, our multi-unit lead structure, the reporting requirements for lead, our case investigation structure, minimizing lead exposure, our safe at home prenatal perinatal lead program, our current caseload data, lead risk assessment data, lead education and outreach data, and our upcoming initiatives. So what is lead and why do we care about it? Lead is a naturally occurring toxic metal that competes with calcium, iron, and other metals in the body. Lead can decrease the brain's ability to emotionally regulate or make rational decisions. Lead can affect development, learning abilities, attention span, and can even cause violent tendencies. Lead can be especially harmful for children under the age of 7 because they're still growing and developing. And of course, during this time period, children tend to exhibit a lot of hand-to-mouth behaviors, which can cause them to unintentionally ingest or inhale lead dust. Lead can be found in paint in homes prior to 1978, in soil, pipes, toys, cosmetics, keys, and other items. Oh, lead is estimated to be found in about 80% of homes here in South Bend and in 70% of homes here in St. Joseph County. If you've heard about lead before, it was likely from the water crisis that occurred up in Flint, Michigan a few years back. However, what a lot of people don't know is that actually in 2016, South Bend actually had 6 times as many children with identified lead poisoning compared to Flint, Michigan. So as we can see here, lead is definitely a huge public health issue here in our community. Here is a diagram of our multi-unit lead structure here at the health department. We have 3 different units that work together here on lead. We have our nursing unit, our care unit, and our environmental services unit. In our nursing unit, we have our disease investigation specialist, which is my position. I receive all elevated lead cases electronically through the Indiana State Department of Health's electronic database. And then we have our public health nurse. She completes all case investigations for lead results that are confirmed greater than and equal to 10. And then in our care unit, we have our community health workers. They complete all case investigations for lead results that are unconfirmed and that are confirmed less than 10. And then in our environmental services unit, we have our licensed lead risk assessors. They conduct free lead risk assessments in these following home environments: where children under the age of 7 live or visit frequently, where pregnant women reside, and where a lead poisoned child has already been identified. Here are the reporting requirements here for lead. Indiana state law requires that all blood lead tests, regardless of the results being elevated or not, are to be reported to the Indiana State Department of Health by the entity examining the specimen, so whether that be providers' offices or labs, no later than 1 week after the test has been completed. This reporting is done either electronically or by fax. Elevated blood lead case investigations are then assigned to the county where the child resides. Elevated, I have a little bit more. Elevated lead levels are considered to be greater than or equal to 3.5, and this is when the health department begins a case investigation on a child. This 3.5 threshold, this was actually lowered from 5 back in July of 2022, as you may have recalled. Go ahead. So looking more closely at my position, like I said, I'm responsible for receiving all elevated blood lead levels here in our county. I will then assign case investigations to either a community health worker or our public health nurse based on those blood lead level results. I will then follow up with each child's primary care provider to ensure that they are keeping up with their doctor's appointments and that they are being retested for lead as appropriate. I will also maintain our up-to-date caseload data here for our county, so I always know how many lead cases that we're currently following and the types of cases that we are investigating. Moving on to our community health workers and our public health nurses. They provide lead education directly at the family's home. They will also advise other children under the age of 7 or pregnant women living in the same household to be tested for lead also. They will encourage confirmatory or repeat testing for lead. When we identify a child that has an elevated blood lead level, we want them to be retested every 3 months up until their level gets below 3.5. They will also offer a lead risk assessment of the home by one of our licensed lead risk assessors if one isn't being done already. They will follow up with each parent to ensure that they are keeping up with those doctor's appointments and that they are taking their child to be retested for lead. And then they can also assist with any social barriers that might prevent them from getting retested, such as arranging transportation if that is a barrier for them. So when our licensed lead risk assessors go out to the home, they look to identify potential sources of lead exposure, such as chipping paint, in order to minimize their exposure to lead. They will educate the families on how to enclose, remediate, and or limit exposure, especially if they're doing renovations in the home themselves. So they'll educate them on lead safe work practices, such as using plastic sheeting to cover up work areas that they're renovating in the home to ensure that they are minimizing the amount of lead dust that could be spread when they are doing those renovations. And then they'll also give the families, if they are needed, a cleaning kit to assist in the process of cleaning up lead dust. If you look at the screen here, you can see that that's the cleaning kit we offer. So we give them Swiffers and Clorox wipes because we highly recommend our families to do damp dusting and mopping of the home, especially if they live in a home that was built prior to 1978, because damp dusting and mopping appropriately cleans up lead dust. If you use something such as a dry cloth, this will only spread the lead dust. It doesn't actually remove it from the space. So we like to supply them with that in case they are in need of that. And then also, if they live in the city of South Bend, if the family does, we encourage them to apply for the city's grant. This grant is offered to city residents who meet certain income requirements where they are able to get their home remediated and renovated at no cost to the family in order for their home to be lead safe. Next up, we have our Safe at Home Prenatal Perinatal Lead Program. This is a program that we actually just recently launched here at the Health Department. This program evaluates potential lead hazards in residential homes before and after pregnancy. It looks to detect and eliminate any lead exposure within the home prior to the birth of the child and before they begin those hand-to-mouth behaviors like I talked about before. We have our expecting mothers complete a short lead risk assessment survey, and then based on those survey responses, those then determine our next appropriate steps that should be taken, such as either completing a lead risk assessment at the home or providing them with educational resources on lead exposure. This program, it actually isn't mandated by Indiana state law. It is just something that we have decided to offer in order to help prevent a lead poisoning here in our community. Next, I'll move on to some recent data we have. Before I actually go into the numbers, I kind of want to go over some, you can go on to the next one. Before I get into the numbers, I want to go over some of the terms that I have listed on the slides here, just so we have a better understanding of what they mean. When I say a child is an unconfirmed case, this means that they've only had one capillary finger stick test. This is where you draw blood from the finger to get a lead level, and it was greater than or equal to 3.5. So that means that we want them to get a confirmatory test when they've only had one capillary test. So when a child becomes a confirmed case, this means that they've had two capillary finger stick tests that were they were taken no greater than 12 weeks apart, or they had a single venous draw done that was greater than or equal to 3.5. So just getting blood from the vein, which is the most precise way to get a lead level. And then once a child is in case monitoring, this means that they are either an unconfirmed case or they are a confirmed case between 3.5 to 4.9 with that lead level. And then if a child is in case management, this means that they have a confirmed lead level greater than or equal to 5. And case management is actually mandated by Indiana state law, which means a home visit and a lead risk assessment of the child's home is actually required. So for the year of 2022, the health department received 162 confirmed monitored and unconfirmed cases and 41 new cases in case management, which gives us a total of 189 cases received for 2022. Then for 2023, we received 272 new confirmed monitored and unconfirmed cases and 58 new cases in case management, which gives us a total for 330 cases for the year of 2023. Next, we're moving on to our lead risk assessment data dating back to 2019. On the left-hand side of the table here, you can see those are the number of elevated lead risk assessments that were completed. So these are the risk assessments that we were actually required to do by state law, kind of like I mentioned earlier, because they had an elevated lead level greater than or equal to 5. And then on the right, we have our public requested lead risk assessment. So this is where we weren't actually required to do a risk assessment of the child's home, but the parent or the homeowner voluntarily wanted us to do one anyways. So for the year 2023, we completed 60 risk assessments for elevated lead levels, and then we completed 57 public requested risk assessments, which gives us a total for 117 for the year 2023. And if you look at that table here, you can see that's significantly greater than any other year that we've done dating back to 2019. Next, we have our lead event and education outreach data. For the year of 2022, the health department did 25 lead events, which resulted in 183 children being tested for lead. And then for 2023, the health department did 40 events, which resulted in 265 children being tested for lead. If you guys have taken a look at your Board of Health packets, you might have looked at the lead testing numbers that we've had. Those testing numbers, those are actually reflect county testing numbers, not just the health department. So our health department testing numbers are included in there, but that does reflect countywide. So providers, offices, and any other entity that might be doing a test. So we do look forward to increasing awareness for lead testing and just testing for lead in general here in our county. So we can all be aware and just help prevent lead poisoning, catch it earlier on than later. And then lastly, our upcoming initiatives. We have coming up on March 26, 2024, this spring, we have our Lead Free by 3 event. We will be partnering with local providers' offices, realtors, and property management groups in order to establish a foundational and comprehensive understanding of the health department's guidelines for testing children for lead and completing lead risk assessments in our homes. So we look forward to working together with these groups to better understand lead poisoning and how to help prevent it here in our community. And then lastly, we also look to offer renovation, repair, and painting training here this spring as well, also known as RRP training. This training is actually taught by the Environmental Protection Agency. And in this training, the EPA teaches individuals who look to work in homes or other facilities that were built prior to 1978. So they teach them on those lead safe work practices that I kind of mentioned earlier. Another way to help minimize the spread of lead dust that can be produced when doing these renovations. So just another way to help prevent lead poisoning here in our county. Thank you so much for your time, and I'll answer any questions if anyone has them.
Thank you. Any questions?
Go ahead.
I was gonna ask, just to be clear, so the lead events and education outreach chart that you have.
Yes.
So those numbers, like the 265 tests, children
Yes.
tested, that's what the health department did.
Correct. Yep. So
Okay.
those are directly from our events from the health department.
Okay, as
Yes.
opposed to the standard countywide data, which is health department plus other providers.
Correct. Yes.
Okay.
Yep.
Okay.
Yes.
Great. I was gonna ask generally, it looks like you have more testing, more events.
Yes.
What were, which is good. What are some of the reasons why you were able to do more testing and this year? Is it just this, more, we're fully staffed or just more manpower?
Yeah. So I actually recently just came on back in September. So I'm pretty new myself. So Renata, I'd like to invite you to come up here if you could answer that, I'm sure better than I can.
Okay.
Renata Williams, Director of the Care Unit. We were able to increase our testings because of the CHWs. In addition to the lead CHWs, our CDC CHWs help identify additional areas within their census tracts. So they may come into contact with daycares that they talk about our services and let them know we can come test the children, and they're very receptive because they've built those relationships in that area. So it's more awareness and collaboration through other CHWs.
Do you target some of your events specifically in areas that with more older housing stock?
Yes.
Okay.
Yes. Yeah.
So the event on March 26th, what does that look like?
So that is going to be more for our property owners, our providers, just so that everyone is on the same page and receiving the same message to the parents too as well, and that they are aware of what the Department of Health recommendations are. We follow the Indiana State Department of Health recommendations, but for example, the confirmatory testing, by state law, they can do it within 3 months. However, we want that confirmatory test as soon as possible. So getting everyone in the room so that we can all be on the same page, and then having some providers also speak themselves to their peers to share those best practices that are working in their office. And then the same thing with the property owners as well.
So I know last year there was training done at the South Bend area realtors offices. I think Heidi did it. I unfortunately was out of town, so I couldn't attend. But as a realtor, it's our responsibility to fill out a lead-based paint addendum for any home that was any home from like 1977 and older. But most people that fill out that form put, I don't know, I don't know. You sign the form, you turn it in, you call it a day. So nobody really takes it, in my opinion, seriously. But I think it's just because of the knowledge and understanding of lead-based paint.
Right.
So I don't know, do you have any plans to do that again or do it? I don't know if you guys did it, but have some type of training for realtors, because I think it's important for them to understand what this means.
We will have property owners there, and I'll open this up to Brianna. So this is a unique thing with lead, that we have the multi-unit. So everybody has their specialty. Mine is more in the clinical space, hers in the environmental space. So I'll let her speak to that, because we do plan to address that portion of it, but she's the expert.
Yeah. Okay. Hi, I'm Brianna. So I work as a lead risk assessor in environmental. So to answer your question, I was not aware of this at the Realtors conference, but that is definitely something we would love to do. We would love to get everybody on the same page. And to the point, like with this conference we're doing in March, really what we wanted to do is make sure that everybody understands what we require, because we do get a lot of
confusion. And as somebody who's done this for 5, almost 6 years, when I read through this stuff, even I'm like, that's intense, that's overwhelming. So we want to make sure that everybody connects, understands that we're not here to make their line of work more complicated. It's really just about protecting the families. So in terms of realtors, that would be even better because we can get it even, more ahead of time. And also, like you were saying about how people just check, I don't know. In the state of Indiana, it's so tricky because we're very limited as a county in what we can do about that. But the state is just like, if you know there's lead, you have to disclose it. Otherwise, you can just say, well, I don't know.
Right.
I'm not sure. So that's what mostly everybody does. So we would like to contact realtors. I did speak with somebody who said that he's part of a realtor Facebook group and he was going to put the conference out there so that we could get your guys' presence as well. Just because, again, we want to make sure that everyone's connecting, everybody's understanding the general requirements.
Yeah. Thank you.
I just kind of wanted to add to that. First of all, thank you for that excellent presentation and all the work that all the different units do to bring this together. So this March event is going to be the first of maybe hopefully many more. And it's the health department's attempt to provide general knowledge and guidance about best practices in the lead space and trying to do that in an inter-unit approach, targeting specific individuals that have direct work related to lead. So our thought as we develop this for March is having primary care doctors or clinical providers come, MAs, and they would have their own workroom where we would work with our clinical providers in the health department to talk about issues that we see, education that we can provide, and streamline the process for communication with the health department. Similarly, we wanted to do the same concept or idea with the realtors, with the people who help maintain the homes, and think about what issues that they're struggling with or what resources they would like, and have that dialogue so they know what our expectation and best practices are, and hopefully be another source of information for them in an engaged manner through panel discussions that are specific to the group as opposed to just one big lecture. So this is something that we're designing and working with. And, as you can tell, we're in great hands because they're going to design, create this. And one thing that would be great from the board's perspective, if you could share and disseminate this information about this event. We're hoping to create this as an RSVP type of situation so we know who is coming and we can tailor our conversations appropriately. So the feedback that you gave about those boxes and just, your own experiences too, and in terms of your network and sharing and advertising our event would be really helpful.
Where is the event?
The
Where
St.
is
Joseph County Library, the main library.
If you can email us flyers,
Mhm.
that would be helpful so that we can spread them
I think we do have a flyer, correct? Yeah.
that'd be awesome.
Any other questions?
Yeah, I just have a couple. You said that there's a grant that people in South Bend can apply for.
Yes.
Is that Mishawaka and South Bend, I assume, like
Is it
everyone in St.
South
Joe
Bend?
County?
Anna?
Within city limits, so even if you have a 5-digit address, not 5 city limits, you cannot apply it strictly in South Bend, but the state of Indiana does have a grant that if somebody from Mishawaka or somebody out of city limits would like to apply, there could do that.
Okay. And then obviously there was a huge increase in detected cases.
Yes.
So are you attributing that to more testing by primary care providers?
Yeah, and of course, with that threshold being lowered from 5 to 3.5, that also does take an account to it. And then I think also just awareness and testing as well does allow that increase to occur.
So we don't have a countywide law or edict or whatever that says that primary care does testing on all kids that have some of those risk factors that pop up, like anemia, and we don't have that, correct?
There's a state law for primary care providers to test all kids by the time they're one test for lead, and then again, a second time before they enter kindergarten.
I believe that's for
Yep.
those who are under Medicaid coverage. Right.
It's
Yeah.
for everybody. It's for
Okay.
everyone.
Okay.
So twice
is
before they hit
happening, yes.
kindergarten. That's not being done. There's a state law that it should be done, but
So-
it's not
I
because
think a lot of it isn't being enforced, unfortunately.
Yeah,
I think that's a
that's a
big problem.
And I
Yeah.
think the other part of it is that education piece, letting people know that if they test for it, and it's positive, the health department would help the provider take care of that patient through the different systems that we have. And that's one of the goals of this conference, so to speak, to provide people with information about what are the laws, what are the requirements, and where does the health department step in to kind of provide the resources that we showed today.
Yeah, if there's a law, it should be being
It-
done.
The law came into effect at like the beginning of last year.
So mostly that, like being a healthcare provider, you guys know, it's like, I didn't know that. So if you are gonna disseminate that information, that'd
Right.
be very important to say like,
Yes.
hey, guess what? This is.
You need to be
required by
testing
law.
those kids.
Oh, they'll be
Yes.
like, "Oh," you know, so that's just a little caveat of that. And then, what's the other thing? Oh, and then you said that there is direct referrals and then there's public risk assessment requests.
Yes.
How many of those are actually positive? Like, do we have a large number?
Brianna?
Yeah, I mean, I wouldn't be able to speak like numerically, like I don't have a quantitative number of how many houses we go to, we test that have lead. I could find that information surely. But I would say majority of the time you will find lead somewhere in the home. And a lot of times when people call in for a public request, it's because they are expecting, or they just noticed an area, or they heard something on the news, or their friend has a child who is lead poisoned. So they just call in because they realize their house is older and they're concerned about it. I mean, I don't want to like make up a number, but 9 times out of 10, you're going to find lead in the home because like Michaela had mentioned in South Bend, 80% of the homes were built before 1978. So it's expected that 80% of homes will have lead in them. So it's a large chunk for sure.
Yeah.
Yeah.
And then you were saying, and there's a state law that they have to disclose if they know of it. Why isn't there a mandate for that? Like, meaning we test at at sale of a
Right.
home, it's tested.
It's not tested. My question is who tests it? I mean, or like that's a big thing because most people reply they don't know and they I would say 99% of them probably legitimately don't know that they
Right.
have
Well, they
lead in the
probably
home.
don't want to know because my husband's a
Right.
builder
Yeah,
and they go,
exactly.
"Oh," you know,
Yeah.
so
Another
in that,
expense, but-
in that lane,
Yeah.
if we're trying to press testing with all home sales in Central County, you know, that's gonna give the builders a heart attack. My husband's hoping not listening.
Right.
But, couldn't we use some of our money, our grant money to develop the program where it's like that we could really help people then to mitigate that, not just be like, oh, we have to test every home at sale and 80% of them are come back positive.
Right.
But here's a grant, here's funding that we can go in and fix this problem, not just be like, well, you can't sell your house and it costs you $5,000 to fix it. Do you know what I'm saying?
Yeah, I know exactly what you're saying.
So.
But
'cause
who
it sounds
does
like
the
a big
testing?
Problem.
So
Like,
that's an interesting question. So we obviously do testing when there's an elevated child involved, or again, if there's a public request and they have children or they're expecting. But in terms of like who's doing the testing for houses where there's no elevated child, there's no child period, typically they can contract out like Americo, Green Tree. There's companies that will do lead risk assessments, or likely they're doing lead inspections. And that's a key difference. I don't mean to confuse it too much, but a lead risk assessment, what we do is we're just trying to find where could the child get lead poisoning. So that's if paint is deteriorated, that's if there's bare soil. But if there's no bare soil and there's no chipping, I wouldn't have anything to test because like the room we're in right now could have lead in all the walls and all in this. But if it's not chipping or deteriorating, it'd be very complicated and very challenging for me to ingest it. So it doesn't really become a hazard in that way. So I have had people who have mentioned, well, when we bought this house, we had a licensed lead risk assessor come from whatever company and they did a lead inspection and they found this, this, and this, and we had it fixed. So in terms of like who's doing the assessments, there's multiple agencies that could do it. We only offer lead risk assessments, so we wouldn't be able to test a full, you know, every single painted component. And then back to what you were saying about disclosing the lead hazards based on the year the house was built. I believe that they just have to say, okay, we know this house is old, so maybe, but the EPA will do audits every so often. So in the time I've been here twice, they've reached out because they wanted a list of all the houses I'd ever gone to. And then they follow up with the owners to make sure that they're disclosing as need be. So they're kind of the enforcement agency there to make sure that that information is being passed along. But again, that's a very small chunk of houses because others could be doing it through a separate agency.
Well, and my understanding is like the lead exposure, it happens in a house that's that old, it absolutely has lead, but it just happens over time as your paint peels.
Right.
Mhm.
Unless they replace like every single thing in
Yeah,
the
which
house,
is not,
which
you
is
know,
not common.
no.
Right.
But I don't know, I just didn't know with, in the thought process of like this grant money, that lead's that's such a big, it's a big issue.
And I will
So-
say this, that the city's grant is a really incredible program, but it is very challenging. You wouldn't think so. Well, yeah. You might not think that it would be challenging to get people to apply for it, but they have had that as a major barrier for them because they have this money sitting and able, and to completely remediate an entire house is very costly. I'm talking like
Mhm.
30, 40, sometimes up to $80,000.
Yeah.
And so they have all this money sitting and they're still, struggling to get as many applicants as they would like to. So I think it would be great to offer more programs to help people, but it would be really difficult because there's a lot of, little bureaucracies type
that's-
stuff where it's like, you have to be up to date on
On the-
this and
on
you
the
have to have
building
your
end and
deed
selling
and,
end,
yeah.
it's like,
Mhm.
it's,
Mhm.
we test
complicated.
wells, that's all I'm saying. We test wells, but we don't test houses
Right.
and, yeah. Maybe
Thank you.
there's a way to think about that more properly, but.
Okay, great. Any other comments or questions?
I actually was curious, broadly speaking about rental homes and any challenges with that. And also, can owners of rental homes, are they being encouraged to apply for some of these grants?
Yes, so anytime that we have a rental unit, the tenant and the property owner will receive a copy of everything that we found in the home. And they will be required to remediate it, and that word can be a little scary, but we also understand sometimes, like, if it's an owner occupied home, they might not have the money to like replace or repaint things, so. Like Michaela talked about in the cleaning kit, we give them different items, like we give them clear packing tape, they can put packing tape over things, stuff like that. With the rentals, we're a little bit more, we expect a little bit more because they pay to live there. And so if a property owner comes in and just tapes everything up, sure, it would be fine, but we obviously want a more long-term solution. In which case, if they are saying, well, you know what, I just happen to own this property, I don't have a lot of money right now, this is very complicated for me to get this fixed, we will refer them to the grant. But we send a grant application if they are within city limits anyways. So when they get their report, there will be an application in there. Sometimes we'll text them or email them the link to do the income qualification. And then again, if they live outside of city limits and we see a need, we will connect them to the state's grant. So yeah, it can be complicated with rentals for sure, but they're definitely being encouraged to sign up for additional help.
Is there a place, I'm sorry, is there a place to find information about the grant that
The
is
cities and
available?
the states, they both are online.
Okay.
But we do have like a flyer, a quick flyer we send out to them. And then there's a link that will just ask you like a handful of questions to see if the family will even qualify. Because if they do qualify, then they have to fill out like a very lengthy application. So it's just kind of a quick thing to see if they would even fall into qualifying for the grant. But all of that information is on the city's website.
Okay.
And then the state's grant is on their website as well.
Thank you.
I was just curious if the grant, the typical grant funding, if the homeowner, property owner would get the full cost of the remediation covered, or if they have to have out-of-pocket expenses.
So to my understanding, again, I think these are probably better questions for the city because I don't know all
Yeah.
the inner workings, but from my understanding, there's no cost to anybody involved whatsoever, as long as you're up to date on, I think it's like homeowners something. And then you have the deed to the house and everything's all good to go. You're not behind on anything, then you can pass through. But to my knowledge, there's no expense made at any point.
Okay.
Because I do remember one meeting, a property owner brought up that he was concerned about when he went to sell it, if he would owe something from the grant being done, and they said that he would not, so. Yeah. But again, great question for the city.
All right, thank you very much. Thank you for all your hard work.
Thank you.
Appreciate the presentation.
Thank you.
Any closing comments on the health officer's report or that section, that item? On
No.
New business?
Hmm.
Next item on the agenda is new business, item 2402, discussion and vote appointments for our various committees. We've got 3 committees, standing committees, Personnel Committee, Finance Committee, and the Appeals Committee. Current, or the members last year, just for everybody's information, the Finance Committee was myself, Dr. Migliori, Betsy, Jill, and Kristen. And if everybody's okay with that, I would propose to keep that slate. Personnel Committee was myself, Dr. Migliori, Ellen, and Rob, Dr. Hayes. I'm sorry, I didn't use doctor in my. That's the Personnel Committee. There's 4 members there. So if everybody's content with that, keep the same slate there as well. And the Appeals Committee is myself, Dr. Migliori, and Ellen. 3-person committee on that one, which we've never met. And
I move to accept the committees as stated.
all right, thank you. We have a motion. Do we have a second?
I will
Second.
You can second.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Aye. Aye.
Opposed, same sign? All right, motion carries. Thank you. Next item on the agenda, 2403, discussion and vote of budget appropriations.
We would like to appropriate a balance that we have in our MIH initiatives fund. The balance we would like to appropriate is $7,871.60. And these are funds that were received through a conference that was held by our department a few years ago.
Can we take these all as a group, or do we need to go one by one?
Whatever motion we get.
All right, any questions on this appropriation? Next one. Fund 4940, countywide lead initiative.
Yes, this is the funds that we receive from the county commissioners and county council for our lead program. Even though they are not adding any additional revenue to this fund, since we have opted in for Health First Indiana, we do have a balance where we can continue to fund our lead program through using these funds. So this is for the CHWs and the work that is being done by the Environmental Health Unit, the lead risk assessment team.
Okay, great. Any questions?
So basically, you're gonna, in a sense, you're keeping the funds where they are until they run out.
Correct,
Gotcha.
correct.
You know, what, can I ask a quick question on the first appropriation, the MIH Initiatives Fund? So that is going in, you're planning to transfer that to the Public Information and Education box, I guess, of our county health fund? Or maybe I just want to make sure I'm clear about.
No, it's in
Where
its
the
own
money's-
fund.
Oh,
It'll
okay.
remain in its own fund.
Okay.
We're just appropriating it to a specific account so we can begin expending the money. But this will stay in its own fund number separate from the county health fund.
Okay, okay, thank you, okay. Thank you for clarifying that, I was confused for a second.
Next appropriation item, Fund 9169, Health Community Health Workers Safety Pin.
And this is the grant that Dr. Purushottam spoke about earlier, where we were awarded this grant based on our previous performance with the Women's Care Center. They are allowing us to also use the leftover funds from the previous 2-year cycle. That is why the appropriation is for $358,000 instead of just the $275,000. That is the new grant award amount.
So that amount includes the 275.
Correct,
Okay.
correct. It was like 82,000 some odd change in carry forward plus the new award of 275,000 plus.
Next appropriation, Fund 9172, the NACCHO Mentor Program.
And this grant, we weren't able to expend all of the funds before the end of the grant cycle or the end of the calendar year. This grant was a deliverable-based grant. So Robin Vita, as the Director of Hope, did complete all of deliverables and we did receive all of the funds. Now we're wanting to reappropriate those funds to be able to make the expenditures for the grant as we submitted to NACCHO when we did the application.
I move to accept the, I'm sorry.
Could I ask one question?
Oh, yeah, yeah.
Thanks. I was curious with the nature of the mentor grant. it talked about stipends to 18 of our community partners to
Mhm.
actively engage in the substance use prevention activities.
Mhm.
And I was wondering if you could give just some more information about what exactly that entails.
Yes, so we've been convening community partners since 2019 as part of an overdose response team. So think the county sheriff, South Bend Police, Mishawaka Police, Fire, EMS, North Liberty, New Carlisle, Southwest Territory, St. Joe Health System, Beacon, Oak Lawn, 525 Foundation, and several of our harm reduction organizations to work collaboratively together to make an impact and decrease fatality from overdose. And since we had the opportunity with grant dollars to provide them with a small stipend for all of their hard work and their support, this is where we looked to provide them that opportunity. So they would then have, I think it's just over $1,000 when we reappropriated, right? Okay, yep, perfect. Just over $1,000 that they could use towards their own substance use prevention effort. So for example, we've been talking with the police department about buying like little pockets that sit on their belts that they would hold their Narcan in.
Oh.
Okay, so this is money they would then use for their own overdose effort. It's not a lot of money in the scheme of things, but it's a nice amount of money to provide as a thank you for always coming to the table, always trying to find a solution and do their part in decreasing death from overdose, non-fatal overdose, and substance use prevention.
And so this is grant money.
Correct.
Additional grant money that you're giving to community partners that they can have some discretion
Mhm.
over, the intent is for it to be used for overdose prevention efforts, but they've got discretion over how they can use it based on the particular organization and what their needs are.
Yes-ish,
Okay.
yes-ish. And then like, for example, since we are the Narcan distributor for the county,
Uh-huh.
any organization that we would provide any sort of monetary funds towards would not use that money to purchase Narcan
Yeah.
because we already provided that to them for free. And they would have to use it towards their overdose efforts.
Okay.
So it can't be used. It could potentially be used for like the sheriff to go to a conference that will focus on substance use disorder, but he couldn't use it to, I don't know, buy t-shirts or something,
Okay.
if that makes sense.
Do they have to tell you what they're going to use it for or give you kind of a ballpark idea of what?
Yeah,
Okay.
yep. And we've been talking about this for a couple of months now, as and I'm thinking through my thoughts here because we come together usually quarterly, sometimes more based on issues. We're in constant communication, especially as it relates to overdose alerts and those types of things. But when we first wrote this grant, we had this conversation with them as a way to ensure their commitment to the effort and that they were willing to work together across sectors to really address some of the issues we knew existed that needed just a little bit more support.
Okay. Thank you.
Mhm.
We have a motion?
I move to accept these budget appropriations as stated.
Second.
We have a motion and a second. Any further discussion or comments? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item under new business 2404, discussion and vote job descriptions.
Before you is a updated job description for community health worker. The only change that was made is under section V, physical effort and work environment. We wanted to add an addendum specifically for our Walkerton Lakeville area CHW, as it has been proven difficult to find someone to work in that census tract and commute back and forth to our offices downtown here. We would offer that option where they would be at one of our local community partners, which hasn't been identified yet. That is where they would be working remotely during their time at the census tract.
questions on this updated description?
So to be clear, because I know we have several different community health worker job descriptions, including some that, if you're Spanish speaking or, if you're, but everything else is consistent. It's just with the other job, the community health worker description.
Correct. It's just where their work environment, where they're reporting to on a daily basis.
Okay, so we're keeping everything consistent except adding this addendum.
That is
for
correct.
This particular job description.
That is correct. Yeah.
Okay.
Any other questions?
One other comment, and I just noticed this, under, even though the other community health worker descriptions would need to be changed too, and we can't do that today, I guess, but Director of Health Equity, Epidemiology and Data Unit, incumbent reports directly to the Director of Health Equity. I think we need to change that to care. Correct, in section 4, personal work relationships.
That is correct. Yeah, we'll make that amendment.
Sorry, I just noticed that.
Given we got a change, can we get a motion just on this description with that change? And then we'll do the next one with a motion.
I move to accept the community health worker job description with the amendment of striking Director of Health Equity and changing that to inserting Director of Care.
Sounds good. Do we have a second?
Second.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next job description under this item is Disease Investigation Specialist, Lead Program Coordinator.
And this is a new job description where we are taking the disease investigation job description and then adding duties of a lead program coordinator. During the presentation that Michaela had made, she had shown the slide where it covers different units for the lead program. We would like to have a lead program coordinator that would be the head of that and be in charge of the full lead program for the environmental health unit, the care unit, and the nursing unit. So they would continue their disease investigation duties and add on lead program coordinator duties on top of that.
Okay, thank you. Any questions on this description or comments?
So that's taking the existing position and adding, right?
Correct, correct.
I move to accept the position description for the disease investigator specialist led coordinator.
We have a motion. Do we have a second?
Second.
Motion and a second. Any further discussion or comment? Question? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next, item on the agenda, grant request, item 2405, discussion and vote, to receive, the community health workers safety pen.
And this is to formally accept the performance award that we have been awarded from the State Department of Health for our Women's Care Center program.
Any questions, or can we have a motion?
I'll move to accept.
Second.
A motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item, which I presume will be 2406, discussion and vote on the
On the FEP grant.
emergency preparedness grant.
Correct.
Okay.
Correct. And there is no application for this grant as well. We have got it, we have received it for many years in the past. They're asking for a letter of intent to be completed. So once we do receive Board of Health approval and then County Commissioner approval, I will fill out the letter of intent. This award amount in the past has been $25,000, and that's what we are guessing it will be for this next fiscal year coming up.
Great. Any questions?
The uses that you listed for using the grant money, you talk about trainings, tabletop exercises, materials. Is that going to be fairly consistent with what we've used this grant for in previous years?
Yes, because we also have deliverables, and Robin can help speak on this. There are actual deliverables also that we have to hit with that grant to make
Okay.
sure that we're in compliance. Do you have anything you wanted to add?
Nope, nope.
But yeah, that's consistent with what we have used those funds for, excuse me, in the past.
And so it looks like this is not salary recovery, it's just materials and programming and things like that.
Correct.
Okay.
Correct. That's fine. The local public health coordinator is within our county budget. So that is a position that is not grant funded. We have that position on staff at all times. This just helps give additional resources to that position.
Okay.
Great. Any other questions, or I'll entertain a motion?
I will move to accept the grant, or I'm sorry, I will move to apply for the grant. Correct?
Yes.
Okay.
Second.
We have a motion and a second. Any further discussion or questions? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Old business, we have none. The public comment is our next item. But this time we'll entertain comments from the public, and so at this meeting, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. So with that, Cynthia Heckman, a new face.
Good afternoon. I'm going to try for 3 topics in 3 minutes. This was another good meeting today. Thank you, everybody. I start today with an amplification of the comment made by Dr. Milligan at December's meeting. While I'm very grateful for the Health First Indiana law, I also, like Dr. Milligan, was disappointed that it had nothing about gun trauma prevention. More of our children and teens die from gun death than from any other type of injury or illness. Gun harm reduction now has best prevention strategies and recommendations based on research, strategies that would fit into the Department of Health ACEs and PACES program. I'd like also to see local data on gun violence and gun death entered as a vital statistic. Second, the Health First Indiana law specifies that for a county our size, the Board of Health should consist of 9 members. We've all known that since last June. What is stalling the 2 mayoral appointments? You as a board should find out. President Lynn, Vice President Migliore, congratulations on being reelected, but I'm assigning you homework. These new board members should be brought up to speed with the rest of you as soon as possible as you head into the many changes and challenges coming up. Third, I was fascinated by the presentations of the grantees last meeting. What a great meeting that was. A lot of ideas and so much energy. One goal is to collect data to convince our Indiana General Assembly in 2025 that funding for Health First Indiana should continue. But the main goal is to actually improve the health of those around us. The core services are not distinct silos of care. They mix with each other. And so I ask you as the board to keep the focus on human connections and open communication. Do I have time for a 4th thing, Marcel? I know that that Indiana Health Commissioner, Dr. Lindsay Weaver, was here last month on her tour of Indiana counties. She mentioned hiring difficulties and that the legislature will be working to address health worker shortages.
That's 3 minutes. Thank you.
Thank you.
Next star. Anybody else? Jenny? Oh, okay. That ends that item. So the next item on the agenda, time and place of our next regular meeting will be February 21st, 2024 at 4:30 here in the council chambers. And the next item is adjournment. Can I get a motion to adjourn?
I will move to adjourn.
Second.
Any discussion? All those in favor say aye.
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 Opposed? Motion carries. We are adjourned.